I will get colds.
Yeah.
I will have twinges. I will get headaches. But it's not cancer.
Yeah.
It's just a headache.
Yeah.
And I think the key there is if it's ongoing, then you go to the GP and you say, I am concerned that I've had a headache for 4 days and I shouldn't have a headache for 4 days and I'm worried that it could be cancer.
Hello and welcome to GP's Talk Cancer, brought to you by Gateway C. I'm Dr. Rebecca Leon and I'm joined by Dr. Sarah Taylor. We're both practicing GPs and GP leads for Gateway C. And in this podcast, we share our clinical experiences, reflections and practical insights to support earlier and more confident cancer diagnosis in primary care. Before we begin, a quick reminder. Although anyone may find this podcast interesting, it is designed for primary care health professionals. Gateway C is a free early cancer diagnosis resource funded by the NHS and based at the Christie NHS Foundation Trust. If you haven't already, please follow the podcast so new episodes drop straight into your feed. And if you think a colleague would find this episode helpful, we'd really appreciate you sharing it. It helps us reach more primary care health professionals. You can access our CPD accredited modules anytime via our website, and all reference studies and guidelines for this episode are linked in the show notes. So today we're going to be sitting down with Sharon Withington to discuss her experiences of having had ovarian cancer. Sharon, welcome.
Thank you.
It's lovely to have you here. You two know each other.
We do, yes.
Tell us how.
Well, Sharon taught my daughters and was head of year for my son.
All those years ago.
Oh, a long time ago, yes. It's a long time since they've been at the school. So you've had a day off?
I have. School released me to come and do this because they know how important it is.
Yeah. And actually, if as we talked about this being for health professionals, if any of your family and friends want to listen, they can do.
Oh, they've already asked.
So this is slightly different. So you're here as a patient today, or your patient experience. So we were talking off air, Sharon. So you're a PE teacher working at Stockport Grammar.
I am indeed.
How many years have you been working?
I've done 27 years at Stockport Grammar School.
Fabulous. Okay. And your sport?
I was a hockey player until I retired from playing. I also played a lot of tennis, but primarily a hockey player. So I've been the hockey lead at Stockport Grammar School since I've been there.
Fantastic. Okay, well, thank you for coming. And I think we're just going to start off. Can you share your story, Sharon, and when all this started?
Yeah, so in October of last year, it's the year before now, I finally decided to go to the GP about symptoms that I'd had for a while, but I'd chosen to ignore. And I'd set myself the timeline of when I came back from the school climbing trip, I would go and see my GP. I had a swollen stomach, which at first I put down to middle-age weight going on. But then looking at my lifestyle and my diet, I thought that I don't think that's right somehow. And the major symptom that I had was that I was leaking urine.
Okay.
And that was becoming an increasing problem. And again, I thought, UTI, maybe. And I'd already been to the GP and said, I think I've got a UTI. And I had a couple of courses of antibiotics, which hadn't solved anything, but I'd chosen to not go back and almost ignore what was going on with my body. The stomach growth had been going on for almost 6 months, a gradual thing, but it had got to the stage where when I looked at myself in the mirror, I actually looked like I was pregnant, and I knew that something was wrong, so it was time to go and see my GP.
Okay.
Had anybody else noticed your symptoms, or were they just all too polite to say anything, do you think?
I was very good at hiding things. We went from wearing very skinny jeans to baggier jeans. We went from tucking shirts in to pulling shirts out. And I just kept it all to myself.
Right.
And was that almost fear of what it could be, or did you genuinely think there was another reason for all these symptoms?
I had a huge fear of what it could be, having lost my mother to ovarian cancer when I was 12 years old.
Right.
So I could see happening to me what I'd seen with my late mother.
Yeah.
And I'll be honest with you, I was petrified.
Okay. And we see that quite a lot, don't we, Sarah, that people often come in later because they're worried about what it could be.
And do you think there was anything at that stage that could have encouraged you to go in earlier? Is there anything that in information from GPs or public information that might have made you think 2 or 3 months earlier that you would come forward?
I think possibly a follow-up from the antibiotics and the UTIs.
Right,
Because if they'd asked me, I'd have told them that things were no better.
Yeah. Right,
but because I wasn't asked, I didn't say anything. And I'm one of those people that I don't want to waste people's time and take up GP's time because I know how busy they are and how precious time is. So I was quite reluctant to go back because I'd had 2 courses of antibiotics, and for me, I was like, well, if that's not solved it, I don't know what will.
Yeah, okay. I think this is quite a common. We found this when I spoke to a couple of women who'd had bladder cancers. They'd had slightly different symptoms from you, but they'd been treated as having recurrent UTIs and sort of said, well, when nothing got better and I was told that the urine sample was normal, I just thought, well, I'd best put up and shut up almost. And not that anybody ever said that to them, but they just thought, oh, well, if the sample's normal and I've not got any better.
But we also know in general practice, and this is reality, we get a lot of requests for antibiotics. We think we've got certain symptoms. I think I've got a UTI.
Yep.
You give antibiotics, you don't hear anything back, and therefore we presume that things are better. One thing I would probably learn from your case, if you're presenting multiple times with similar symptoms and we're having negative urine cultures, I don't know whether your urine was ever tested.
Yeah, and it was absolutely fine.
Yeah, it was absolutely fine. That should be then a bit like,
But there's it's also the same thing that we talk about with almost everything, isn't it? That there's almost a bit of when you're actually talking to a patient or treating for a UTI, saying, I think your symptoms are probably due to a UTI. Yeah. We'll give you these antibiotics. If you have these antibiotics, I would expect you to be better within a week. If you're not, you should be back in touch,
don't we? We almost give the emphasis back to the patient and say, please come back to us.
We do it with chest infections.
We do it with ear infections.
If I do a chest X-ray and the chest X-ray is normal, I've got it all sorted out so that if a patient has a normal chest X-ray, I say, well, if you're not better, I still want to see you in 2 or 3 weeks' time. And that would possibly, would that have got you back if somebody had said to you explicitly, I think this is a UTI, but if you don't get better, come back and see me.
Yeah, and I would have gone back.
Yeah,
would you?
Particularly because I knew there was something not right.
Yes.
I'd got to the stage where if I lay in the bath, I could see that my stomach was more swollen on one side than the other.
Okay.
Right.
And I was like, this isn't right. And, I was lethargic as well. And it was just uncomfortable.
I think you were telling me when we met beforehand that you on the school trip you were having a nap during the day.
Yeah. So we had 3 members of staff, and they were climbing on a rock face, in beautiful sunshine. And one afternoon I just said, can I just go back to the car? Because we had a car and a minibus. And the trip leader said, yeah, you okay? So I said, no, I'm just really tired.
Yeah.
And I just went and got in the car. And when they came back, I was fast asleep, and it was like 2:00 in the afternoon in blazing sunshine, which is so like me not to want to be out in it. But I was just exhausted. And broken sleep as well because I was uncomfortable because I had like this big bump that I wasn't used to, and I couldn't curl up in a ball. If I lay out flat, I felt like something was pulling.
Okay.
And I just, as I say, I was just exhausted. And I came back from the trip on the Sunday, and I went to the GP on the Tuesday.
And what happened at the GP follow-up appointment when you went in on the Tuesday? Were they concerned? Did they examine you and then further investigations?
Yeah, the GP just looked at me and looked at my face and then said, can I have a look? And referred me on the 10-day pathway.
Okay.
So I had an ultrasound on the Thursday. So 2 days later.
Yeah.
And when I walked in, the lady said, "Oh, my, you've drunk a lot of water." And I said, "No, that's just my stomach."
Oh, wow.
And I could almost tell what she could see, and by the way she'd said that, so I knew what was coming.
Okay.
And then after the ultrasound, I was referred to Stepping Hill, to oncology, gynecology there. Had a long chat with them. They needed to take a sample. So that was on a Friday, and I went into Stepping Hill on the Monday to have the sample taken. Unfortunately, the sample crumbled, so I had to have a second one. And then I had a follow-up appointment, which basically told me, you've got stage 2 plus cancer, and it's going to move very quickly from here. Within a week, I was in the Christie with a consultant to be told it's stage 4 and your tumour is very, very big, and this is the course of action we're going to take. And it was chemotherapy, see what happens tumour-wise, and then when it has shrunk enough, if it shrinks enough, then surgery, and it will be very major surgery. And I started chemotherapy 10 days later.
Gosh, wow. Do you know whether your GP did they do an ultrasound and CA125, or did they just do the ultrasound?
They did both.
Right, okay.
So I actually found out that I did have cancer by picking up my blood results on the app.
Oh, so your CA125 was already raised before you'd had the scan?
It was 225.
Okay.
Right.
So
Okay.
obviously when I read that on the app, I Googled it and I was like...
Oh, right.
And that was the day I walked out of school and didn't go back for 9.5 months.
Right.
You see, this is a problem, I think, as far as having that CA125 raised without proper context. So
That is true.
And this is not saying that patients shouldn't know what their blood test should be. But seeing that raised CA125, that means that somebody has looked at it. They probably will have put something like referred on for a scan. Nobody's told you what it means, so you've gone away, Google what does a raised CA125 means. There's multiple reasons, but the main reason is ovarian cancer. That was the thing that you feared.
Yeah.
How do you feel about that, Sarah, as far as being found out that way about...
Well, we talked about this, didn't we?
Yeah.
And you said that you felt that actually, because it's difficult, isn't it? So do you bring everybody back in for an appointment? Do you let people find out on the app? Do you phone them? And if you phone them, do you, how does it, you know...
And particularly that if you just had a blood test that day, so Sarah asked the question, did you just have bloods or were both organised? We would practice the same. If we were concerned that this could be an ovarian mass, I would personally do an ultrasound and a blood test on the same day, okay? So then the blood test comes back, CA125 raised, the scan's already arranged. I may not, hand on heart, then phone the patient to say, because I'd only phone the patient if they weren't expecting an appointment. Does that make sense?
Yeah.
So this is where, and it would be the same with a PSA or something.
But does that not vary just patient to, your preferences probably be different from somebody else's?
Yeah, and it's really difficult, isn't it? I mean, it's the news that nobody wants to find out.
Of course.
And I was lucky in that it was break. I was in the office and I was actually showing them another test result, which was that bowel cancer had come back clear because I'd done the school
fit
test
yeah.
a couple of weeks before, and I was saying, oh, well, at least that,
Yeah.
And then I was like, oh, what's that? And fortunately, I had Katrina with me, who obviously and I've worked with for 27 years, and she just looked at my face and she saw me type and she said, what's wrong? And I just went, I've got cancer. And she just looked at me and I said, and I'm going home.
Okay.
And with that, I just gathered my bag. I picked nothing else up and just left the office, signed out, and then was intercepted on the way to my car by the senior deputy head because Katrina had gone and found her. And she just said to me, what are you going to do? So I said, I'm driving home and I'm going to go to the GP practice and demand to see my GP. And she just said, well, and I said, I don't know when I'll be back. And as I say, I didn't go back after that because mentally I didn't want to be in school.
No.
But I don't know whether it was any better for me to find out from the app, or I think a phone call might have worried me even more.
Yeah.
And I think that is just a patient preference.
Yeah.
And it might be that you would say to a patient, do you want your results on the phone?
Okay.
Do you want to come back in? Or do you want me to put them on the app? And with modern technology, it's there for you to find out.
It is.
And
You just routinely go onto the app. As soon as you look at them,
As soon as you've filed,
As soon
as you filed them.
so they come to us as provisional.
Yeah.
We then look at them, and it would be anemic, CO125 raised. So I would put CO125 raised, follow-up already arranged. That's
Yeah.
how or investigations organised. That's how I would put. And then that would then just routinely just go straight into your app. So we almost don't have a way
I think there's
of...
lots of things there, isn't there? Because I think what you were just sort of suggesting a couple of minutes ago is, if you've got a cancer diagnosis, it's bad news, and you're not going to, however you do that, whether you do that in person, you're not going to change the news.
It's no better however you do it. It's news that nobody would ever want to hear, and it's devastating.
Yeah.
Because you just panic and think, what's going to happen?
Yeah.
Because how
you obviously
invasive-
did as well. But if you've seen your mum,
Yeah, and I'd seen what could happen.
Yes.
Thank goodness everything's moved on so much since then.
Yes, absolutely.
We're a long way down a line.
from when you,
Absolutely.
Yeah.
It was. My mum had surgery and had a full hysterectomy, but that was all that they could do at that stage. Now, when you think my tumour was nearly the size of a rugby ball, and by the time I had surgery, it was the size of a grapefruit. So the chemotherapy did a huge amount of work pre-surgery to shrink the tumour, and then of course there was the tumour, and then there were the subsequent tumours that were taken out. I had high PEC post-surgery, which is amazing, and I know is terribly underfunded.
Yeah.
The Christie are doing everything they can to get more funding for that.
Yeah.
And then as soon as I was well enough post-surgery, I was back on chemo.
Right.
And now I'm on immunotherapy once every 3 weeks and daily tablets. But I'm here,
Yeah.
and I'm well,
Yeah.
and I'm fully functioning,
Yeah.
and I'm as good as I'm going to get.
Yeah.
I have a stoma now,
Yeah.
because they couldn't save my bowel, because there was a risk of leaving some tumour behind if they did.
Yeah.
I was devastated when I found out. But you soon think, well, if it saved my life, then it was absolutely the right thing. And I'd been pre-warned pre-surgery, but you always hope it doesn't happen.
Yeah.
But, you learn to live with it, and it's part of me now, and it's just part of my routine.
Yeah. Yeah. So I was going to ask about the family history. Did you share this with your GP when you first presented? Maybe not with the UTI stage, but the stage when you realised that there was something serious wrong with you?
No, I only disclosed that to my GP when I got the blood results back.
Right.
And when I went that afternoon. And she looked at me as if to say, oh, you poor person, because you've been through this as a child and you've seen. And she just said, we will do everything we can for you.
Yeah.
And it's already in the process. It's already going through. And I believed her.
Yeah.
And she did. And
Yeah.
the Christie have.
Yeah.
And when you think about the extent of the cancer, it's a miracle I'm here.
Yeah.
Next week I'll be 12 months post-op.
Yeah.
Wow.
And it's amazing to think how well I am from how ill I've been.
Yes.
And everyone that's works like you, it's quite amazing. If we didn't know, we would never know, because things like the hair's grown back, the colour's come back in the skin, the eyebrows have come back, the personality's back because I'm stronger than I was,
And you're back working?
Yeah.
Amazing.
Yeah.
What contact did you have from your GP after you were diagnosed?
Honestly,
Yes, please.
I've not heard from my GP since.
Right. And would you have liked to have? Because I
Yes.
think... Right,
I
okay.
feel I feel almost abandoned by my GP's practice.
Right.
I've been one since for antibiotics, funnily enough, which was a tooth problem. My GP that I saw is actually on maternity leave. But that's the first time I've been back to the GP, or the first time a GP has contacted me. The practice nurse has contacted me to see if I need any support from cancer charities. And I've said no, thank you, because I didn't want any. And when I went to see the guy about my infection of my tooth, I said to him, I need to tell you that I'm on ongoing immunotherapy treatment for my cancer. So you just need to check that I am able to take these antibiotics. He was a locum. He was a lovely lad. He went and found a more senior doctor to check what he was prescribing was suitable. And he was very apologetic. I said, no, I'd rather you checked and got it right. But that's the only contact I've had with the GP since.
Do you think many GPs would actually know about possible drug interactions between immunotherapy and...
Well, I had some students do a project last year where they went through all our patients on immunotherapy and made sure they were all put into the hospital medication section of our drug screen. So therefore, if we prescribe anything, the computer tells me that they're already on it. And I think, and that's one of the things that I'm trying to drive as a sort of across Greater Manchester, that something that actually we should be recording. We know if patients are on immunotherapy all the time, we should have that on our notes. Not that we're responsible for prescribing it, but that we then know.
So it comes up.
But for two reasons. One is for drug interactions and one is for potential side effects, because there are a lot.
Yeah.
And, you know, and so we might be the first, you might come in with diarrhea and
it might be the tablets.
Yes. And if we don't know you're on them, then we're a bit... and you're probably much more up on what you're on and what the side effects are than quite a lot of our patients. So, you know, we can't rely on the patients to... we shouldn't be relying on the patients to tell us.
Can I ask your role as a teacher, how your pupils have dealt with your diagnosis and since you've been back? And have you needed to support them? I see a lot of young patients who are concerned that themselves have got cancer, or, you know, every twinge. I'm just wondering if that's a change since you...
The kids have been amazing.
Good.
They were just so thrilled to see me back.
So nice.
I went back just before the summer holiday last year. You know, baseball cap on, no eyebrows, looking very frail. But I wanted to go in before the summer holiday, and it was just amazing to see them. I'd had cards from them. I'd had flowers from them. The climbing crew were just like, oh, we're so glad to see you back. You know, the hockey players were like, oh, God, we've missed you this season. You know, the children in Nicholson House, because I was a head of house at the time, were like, oh, where have you been? You know, we're bottom of the table. We've not been able to do it without you.
So nice.
And it just walking down corridors, that, you know, the kids were like, oh, Miss Withington, lovely to see you. And they've been fab.
Yeah.
And they've been incredibly understanding as well, because I can't run around like I used to.
Yeah.
I don't demonstrate like I used to.
Yeah.
The personality's still there.
Yeah.
But physically, I just can't do it anymore. But they understand. And they might see me sit down on a bench for 5 minutes and genuinely they'll ask if I'm okay. Because they're great kids. They really are great kids. I know it's difficult for some pupils because they're going through it with family members. But I hope that by seeing me fit and well and back, it gives them a little bit of hope and gives them, you know, a little bit of a light at the end of the tunnel, and the possibility that things will be okay in the end.
Yeah.
It's difficult for them.
Yeah. And I think you were head of year when there was the
girl that was diagnosed as a third year.
Yeah.
And had a very aggressive bone cancer. And to support the year group, I stayed as their head of year right through to fifth year, which was when we lost her, unfortunately, for continuity from a sort of pastoral support side.
And I think because my son was in that same year, and I think it really affected an awful lot, particularly her close friends as a year group for quite a long time, because it really shakes their confidence. And I think it's a difficult balance then to get right with, and it'd be interesting to see what you think about it, how you make teenagers and young people aware of the potential symptoms of cancer without scaring them.
Yeah, and it's that whole thing where if you're worried at all, you must go and seek advice and help from your GP, whatever age you are. You know, I mean, I got to 54 before something happened to me. But, you know, that child was 14, you know, and may have had cancer when she was 13. No, it's no age whatsoever. And one of the things that I found upsetting at the Christie was to see children, because it should never happen to a child. It's bad enough that it happens to anyone, but no child deserves that. And that's the bit that has been the hardest for me when I've walked into Christie for bloods or treatment, seeing children. I don't know whether it's because I work with children as well, and it's just so wrong that it happens to children. But, you know, that message to just seek help early is so critical, so critical.
We're talking to a patient, we're talking to a young woman in a few minutes who actually had a lymphoma as a child. So it'd be interesting to see how she, as well, how she thinks we can make people aware of things without alarming them.
I think it's giving access to information without forcing the information.
Yeah.
And, you know, just making people aware of websites that they could look at, encouraging them to talk to people and to get them, the parents to get them to a GP if they're not sure at all.
Yeah.
You know, if it makes a difference to one child, then it's worth doing.
Yeah, absolutely. Yeah. Yeah.
I'm really sorry that you felt you were let down by your GP practice. And I think something that Sarah and I try and encourage with ourselves and our colleagues in general practice is to contact and support as much as we can. So if you could almost give some words of advice from your experience on how general practice can do better.
What would you have liked?
What could have happened?
I would have liked a phone call.
Yeah.
When the biopsy results had hit the GP.
Yeah.
I would have liked a phone call at some point during my pre-surgery chemotherapy to see how I was getting on.
Yeah.
Because there were times when I was absolutely on my knees.
Yeah.
You know, because everyone you have is a little bit harder. You know, I'd got to a point where I was not sure how much more of it I could take. You know, post-chemo, I was spending 3 days in bed and literally crawling to the bathroom, living off Lucozade Sport because I just felt so dreadful.
Yeah.
But I knew I had to do it because if I didn't do it, what were my chances? And I wanted to do everything to get better. And definitely a phone call post-surgery to say, you know, you've had 12 and a half hours of surgery. How are you?
Yeah.
You know, you've had 10 days in the Christie, 2 weeks in the Christie because it fell over the Easter holiday. How are you doing at home? You know, because my GP practice is in my village. You know, it's literally down the road. And I just would have liked a little bit of contact from them.
And did you want that from the GP or was it just from somebody in the practice? What would
I think even the practice nurse would have been just fine, just to see. Just someone ask how I am, apart from, you know, family. And don't get me wrong, you know, the Christie, a bang on how are you doing, how are you coping, you know, can you do this, you know,
so
are you ready
we've
for
changed
chemo?
our system recently where our care coordinators contact all our patients but have a very quick access to me if the patient's got a query. And they will then follow them up. So they get a link with somebody in the practice who's got, you know, who can advise on, you know, where to go if they want to go to Maggie's, which we're very close to, or anything else like that. But also, you know, if you need a sick note, because it is just a sort of logistical thing, and actually quite a good, because you will have needed sick notes.
Yeah, I just did that all via the app.
Right.
and just requested it, and it just.
But then,
came
that's a
through
good
and-
opportunity when you get a request for a sick note, just to ring somebody and say, and I might start taking, when I'm triaging, if I get a sick note, I might just, instead of just sending it off, just make sure that I call and say, I know you've got
Yeah.
your sick note. I'm very happy to give it to you. I'm not questioning your sick note, but how are you doing?
How are you? And do you know what? That would have been wonderful. Absolutely wonderful.
So sick notes are, because it's difficult to do something spontaneously without a request, because there are so many patients and you don't. But actually, a sick note is a really good touch point to go. Actually, I'll just give Sharon a ring and see how she is.
Particularly when you're giving one. Mine always said ongoing treatment for ovarian cancer. When I put in Y, so it was there.
Yes.
And as you say, the opportunity is there to then just think, do you know what? I'll just give her a quick call just to see how things are going.
Yeah.
Interestingly, the Christie send you a questionnaire to fill in online, literally before any appointment whatsoever, whether that be bloods, whether that be treatment, whether that be my phone call about my tablet release that I now have. And even something like that would have made a difference to me.
Okay, so there are some quite good questionnaires that we can attach to, the online triage stuff, just saying what's going on and how are you coping.
The interesting one from the Christie is they say, rank how you feel from 1 to 100.
Ooh.
And then the lowest I've ever gone is, I think, 90, which was post-surgery. And when I did one last week to get my tablets released, obviously 99. And when she phoned me, she giggled and she says, you never put 100. So I said, well, no, there's always room for improvement.
Yeah.
But even by that number, a GP would have an idea of how somebody is actually feeling or what their frame of mind is.
Yeah.
Because your frame of mind's also important.
Totally.
And that mental health side of it. I've been lucky in that I've been strong.
Yeah.
And it's not affected me mentally. But I can imagine how for some people who live on their own, they could go into a very dark place very quickly with a diagnosis and treatment like this. And even to just have that ranking from 1 to 100, if you pick something up that was either lower than the time before or was a low number, you'd think, why have they said only 50?
Yeah.
Yeah.
Why is Sharon only set 50 when she's normally a 99er?
Yeah.
And for me, that would trigger me to make a phone call.
Yeah.
And what we've started to do in the practice is, rather than picking up the phone saying, Sharon, how are you? We often will send a text just to almost say, we've just received your correspondence. We're really sorry what's going at the moment. If you'd like to speak to your GP, please follow this link. Because we also know that you're bombarded with appointments and people asking you lots of questions. And you might say, thank you, but not now. So we almost give the onus to the patient.
But you're offering the opportunity.
We're offering the opportunity.
I think the sick notes are a good opportunity.
And this is your name, GP. This is who you're under. If you'd like to speak to them, this is an opportunity to do that. But I think you're absolutely right, because we can't be thinking all the time. But a sick note comes in, ongoing treatment for ovarian cancer. Tell me, how are you?
Yeah. Next time it's on my triage list, I'll just put call.
Yeah, and you the sick notes were for a month, sometimes 6 weeks. So, if you're going to, it's quite a period of time between those two sick notes as well, and a lot can change in that time. The first sick note post surgery, I wouldn't want to speak to anyone because I felt dreadful. But a month later, I could have said, "Oh, they say I'm well enough to start chemo again." And it's almost being proud of yourself as well for how well you're doing.
Yeah.
And the Christie are great like that. They're like, you're doing so well, and I'm like, oh. How far have you walked? And I say, and they're like, good gracious, that's brilliant, and just to be able to tell a GP how well the Christie think I'm doing would have been nice as well,
Yeah. No.
Can I ask you about surveillance and almost scan anxiety? Is that something that is real?
Huge.
Okay.
Huge. You have the build up to your CT scan.
Yeah.
You have the CT scan, which it's not pleasant, but do you know what? Everyone in the waiting room at the Christie is in the same situation, and we all make light of it. And You know, I went on a Friday night and we were pretending that the drink was a cocktail because they were all funny colours, and we all laugh about it and we all share our story, and everyone's at a different stage, and you know, but then you've got that dreaded time where you're waiting for results.
Yeah.
And my practice nurse said to me, "How do you want your CT results?" And I said, "Well, if an appointment card comes, I'll know that there's a problem.
Okay.
May I have a phone call?" And she said, "Yes." I said, "But may I have a phone call either way?"
Yes.
And she said, "Of course you can."
Okay.
Because it takes me 2 minutes to phone you.
Okay.
And, you know, I got a phone call last week to say your CT scan was clear. And I said, "Well, I was hoping it was because it's nearly 3 weeks since I had it."
That's a long time, isn't it?
It's a long time to wait. But the longer it goes, the more chance there is of it being clear, because they'd want, I know how quickly the Christie would move and they'd have wanted to see me. But that scan anxiety is huge. You know, I've had 3 clear scans now.
Fantastic.
And after the first one, which was the first one post-op, I burst into tears because she said, "You know, you are now cancer-free." And I was like, ugh. And I didn't believe her. She had to get me a glass of water. And then I filled up, and then I did a full circle moment in that when I was walking out of the Christie with this wonderful news, I bumped into the nurse that had looked after me when I had a reaction to my first chemo and had brought me round. She was the girl that had the oxygen mask on me and the defibrillator, and she said to me, "Sharon," I was like, "Jess, so lovely to see you." I said, "I've just had a CT scan and I'm cancer clear." And she burst into tears, you know, and it's a lovely moment, and it's a lovely thing to be able to tell your family and your close friends, because they worry about those scan results too, because it affects them as well, you know.
And what we see in general practice is because more and more people are living with and beyond cancer, which we hope that cancer will become more like a chronic illness.
Yes.
And you may have to take a tablet for the rest of your life.
Yep.
But you will live a long life, similar if you had diabetes, asthma, etc., a chronic illness. But then it's the health anxieties that go alongside that, every twinge, every infection, every this. And we as GPs have to manage that. And I have a lot of patients who have had previous cancer diagnoses with significant health anxieties. And it's really hard because we can't be sending people who've had a previous history of breast cancer, or they've got a family history of breast cancer, or their friends had breast cancer, for a mammogram every year. It just isn't practical.
No.
So this is something, these are things that
difficult
we
one,
have
isn't
to
it?
deal with
Yeah.
as well.
Yeah, and as somebody who has had cancer and still has a fear of cancer,
Yeah.
you do worry about every twinge. You wake up with a bit of a headache and you worry that you've got cancer of the brain.
Yeah.
You know, you have a stiff back because of the way that you've slept.
Yeah.
And you think, "Oh, I've got cancer of the bones."
Yeah.
And you have to have a word with yourself. And I've got better at having a word with myself.
Okay.
I was paranoid about picking up infections at school. You know, sneezy kids all around me. You know, dreadful business.
Yeah.
A crowded office with people snivelling, opening windows all the time. You know, advised not to be in that office if people were ill. But then the isolation factor, if I wasn't in the office, was worse for me.
Yeah.
And I've got better. You know, I'm obviously not going to put myself next to a child who obviously has a very bad cold, but I've got better at managing things, and I will get colds. I am concerned that
Yes.
I've had a headache for 4 days, and I shouldn't have a headache for 4 days, and I'm worried that it could be cancer.
So it's this. We are also trained in something called ICE, which is ideas, concerns, and expectations. So if you come and say, "I'm concerned I've had a headache for a week," or almost I have had ovarian cancer and I'm worried that it's related, and what do you expect from us? The E, I expect you to reassure me, test me, all these other things. So
Yeah.
this is why it's important that also patients come to us and we ask the right questions as well. So both ways.
And we always talk about things that are persistent and progressive
Yes.
in relation to cancer. So, if your headache comes and it's gone within a couple of hours and then you don't have it for another couple of weeks,
It's a headache.
it's a headache.
Yeah, absolutely.
But if you have it every day and it's getting worse every day, and then you should get it checked out. It may well just still be a headache, but that's our job to do. It's our job.
But I also look at things like how much screen time have I had. When I'm writing reports, I do have a headache when I get home because I've sat and looked at that screen all day.
And lack of sleep. And
absolutely,
all these other things.
and it's rationalising things as well. But that access to the GP, if you're worried in any way, you've got to go.
Yeah.
And that reassurance side of it, that protocol that you've got, great routine, it's what's needed.
It is, yeah. And have you had a better hockey season with you back?
We don't want to talk about
Okay,
it.
don't
want to
okay.
talk about it. It's not been great.
Oh dear.
We did win the under 13 North round of the Nationals, which was great. But it's been quite a lean season. I'll put it that way. It's been a lean season.
Season.
Yeah, the kit looked great, but it's been a lean season.
Less
Oh dear.
results.
Oh well.
Well,
That
hopefully
happens.
the summer season. As a tennis player, I hope that the tennis season is more successful.
Yes, let's hope.
And I hope
Yes.
Manchester High be Stockport because I've got
Harsh,
I have a daughter at Manchester High, so we'll see you there.
Yeah, see you there. See you on
there.
the court.
See you on the court.
Take you on.
Exactly. Me and you will get our rackets out. Okay. I'm very rusty.
I'm terrible.
Okay, so key clinical points. Just something that you've learnt that you'd like to highlight from what we've discussed today, Sharon. Anything that comes to mind?
That GPs can be accessible, that GPs won't think you're wasting their time, and that GPs will show empathy to someone who is concerned, and that GPs will act. And I already know that GPs act because, that 10-day urgent pathway is less than 10 days when it needs to be. And if anyone is worried, then that urgent pathway, it's in place and it works. When you look at the speed that everything happened with me once I was diagnosed, it's unbelievable.
I think I would say that we need to be more rigorous on safety netting UTIs probably, because I think there are, particularly in older women in their early 20s, maybe not so much, although we need to be thinking about STIs, but in older women, we're just not very good at making sure people come back if their symptoms haven't settled. And I think that a lot of the time they're just not symptoms due to UTIs. And I think we're not good. That would be my main take home from this. Yeah,
I think it's a phrase that middle-aged women have caught on to and call everything a UTI.
Yes,
yeah.
And,
I think you're right.
I think I've got a UTI.
Yeah,
I think I've got a UTI. And you hear it all the time. I hear it with neighbours. I hear it with colleagues. I hear it with friends.
Yeah.
Oh, I've had a UTI. And now when I hear it, I think to myself, well, did you have a UTI?
yeah, yes.
And
Yeah, so if you've only got a couple of symptoms and no urine result,
Yeah, totally.
and
somebody who's not better,
and I always say now to a friend who says, "Oh, I've had a UTI and I had antibiotics," I say, "Are you better?"
Yeah.
And if they say no, I say, "Well, you need to go back to your GP."
yeah,
Good.
Very matter of fact, and they listen to me because they know. I've been through quite a rigor with it, but they know that I mean, just go back to your GP.
And actually, I know this is a cancer podcast, but we also know that UTIs of postmenopausal women are much more likely to be menopausal symptoms as well.
Totally,
So,
yeah.
so even though it might not be a serious red flag symptom, it could
Might
be
just
other
need a
things as
different
well.
treatment.
Yeah.
Yeah.
And my key clinical point is family history. We try and embed it into our normal consultation now, but your GP acted quickly as far as the bloods and the ultrasound. if they maybe had asked also about family history, that would have added an extra tick in the increased risk factors. So it's important to ask.
Yeah. And it's important to tell. From a patient point of view, it's important.
But it'd be interesting if you were actually asked. Were you asked and you said
You wouldn't
no?
have lied.
No, absolutely not.
Exactly.
I
So I presume you weren't asked.
no.
Yeah,
No.
there you are. Yeah.
But with hindsight, maybe I should have told.
But we needed to ask.
Yeah, we do need to. It's our job, I think.
It's our job to ask.
Yeah.
Okay. Final thing is something that we've brought into the last series, a word of the podcast. So it can be a word or it can be a phrase. Something that our listeners can go ahead and think about that word related to this podcast. We'll ask you last because I've just put this on you. Sarah, you're first.
I think I'm going to go for empathy, because I think you said that the GP showed empathy when you first went in, but that wasn't necessarily there later on just because of lack of contact. So I think, but that you feel it would have been important. So I think I'll go with empathy.
I'm going to go with empower, because it is empowering the patient to come back if we've given them the right information by safety netting them. That's another word.
Oh, you're greedy.
I'm so greedy.
Is that too?
Well, I'm explaining, so I'm going empower.
And I'm just going to say early detection.
Lovely.
Yeah.
It's just so vital. You know, if I'd have gone 6 months, 4 months prior, that tumour would have been so much smaller. The chance of spread would have been less, and the surgery would have been far less invasive. You know, I look at my scar, which it's healed beautifully, but I just think to myself, if I'd have gone when I should have gone, that could have been maybe keyhole. You know, and nobody sees it, so it doesn't matter. But I see it, and I've let myself down by ignoring symptoms. And that's why early detection is absolutely key.
Thank you, Sharon.
Thank you. That's really...
Thank you for a fantastic podcast.
Yeah, it's
and
really
for
good.
your openness and candidness. Is that the right word?
Yeah, I think so. Yeah. I think when I saw the interview you'd done in the MEN, I spoke to Ali and said, I said, I know Sharon. Do you think she'll come on our podcast?
Yeah.
She said yes.
The girls at Stepping Hill, who I originally was assigned to, I'm still in touch with them. I ring them, for example, when I get a clear CT scan or, you know, when things change. And they're delighted that I'm doing this.
Great.
They're actually using my story from the MEN for a presentation they're doing today. They asked my permission.
Yeah.
So use away. I said, if it's going to help, just do it. And they're really proud of me for doing this and getting the message out there.
It's the first, we always try and put patient stories in, but it's the first patient interview that we've done in the podcast. But I actually think it's really good because you've got so many different things across that we would have not got from
an ovarian specialist.
An ovarian specialist.
Yeah. It's different. So thank you for listening to GPs Talk Cancer from Gateway C. A big thank you to Sharon and to our producers from Gateway C and Listening Dog Media. Thank you for joining us, and we'll be back again soon.